So, we will start with the anatomical position. It is important that medical students and medical practitioners are knowledgeable of the anatomical position so they may have a uniform basis of naming landmarks in the body. What is the anatomical position? It is a description of any region or part of the body in a specific stance. This is Keisha. She is going to demonstrate to you the right stance for the anatomical position. In this position, the body is upright, directly facing the observer, feet flat, and directed forward. The upper limbs are at the body's sides, with the palms facing forward. Okay, now for supine and prone position, we have another Keisha, but this time it is Keisha Clay. So, if the body is lying face up, it is in the supine position. If the body is lying face down, it is in the prone position. Directional terms are words used to describe the position of one body relative to another. Many directional terms are grouped in pairs that have opposite meanings, or are grouped together to have combined meanings. So we have here Shara to demonstrate these terms. Anterior view, at or near the front of the body. Posterior view, at or near the back of the body. Lateral view, farther away from midline.
Here's July to further demonstrate more of the directional terms. Proximal is nearer to the origination of a structure, while distal is farther from the origination of the structure. Example, the phalanges are distal to the shoulder. Anatomical terms related to movement. A site where two or more bones come together is known as a joint. Some joints have no movement, like the sutures of the skull. Some have only slight movement, superior tibiofibular joint are the examples, and some are freely movable, like the shoulder joint. Flexion is a movement that takes place in a sagittal plane. Here is Miss July Balingan to demonstrate the anatomical terms related to movement. Flexion, for example, of the elbow joint approximates the anterior surface of the forearm to the anterior surface of the arm. It is usually an anterior movement, but it is occasionally posterior, as in the case of a knee joint. Extension means straightening the joint and usually takes place in a posterior direction, like so. If extension is greater than 180 degrees, as when you move your arm posteriorly beyond its normal anatomical position, it is called hyperextension. Abduction is a movement of a limb away from the midline of the body in the coronal plane. Adduction is a movement of the limb toward the body in the coronal plane. In the fingers and toes, abduction is applied to the spreading of these structures, and adduction is applied to the drawing together of these structures. Pronation of the forearm is the medial rotation of the forearm in such a manner that the palm of the hand faces posteriorly. Supination of the forearm is the lateral rotation of the forearm from the pronated position so that the palm of the hand comes to face anteriorly. Circumduction is the combination in sequence of movements of flexion, extension, abduction, and adduction. Protraction is to move forward. Retraction is to move backward. This is used to describe the forward and backward movement of the jaw at the temporomandibular joints, like what July had just demonstrated. Inversion is the movement of the foot so that the sole faces in a medial direction. Eversion is the opposite movement of the foot so that the sole faces in a lateral direction. Opposition. In the palm of the hand, the saddle joint between metacarpal 1 and carpals allow opposition of the thumb. This is the action by which you move your thumb to touch the tips of other fingers on the same hand. This unique action makes the human hand a fine tool for grasping and manipulating things. When we study the parts of the body, we also study their relativity to planes. Planes are imaginary flat surfaces that pass through parts of the body. We also study parts of the body in sections which are cut along a certain plane. Frontal or coronal plane. It divides the body into front and back portions. The transverse plane. It divides the body into superior or upper and inferior or lower portions. Sagittal plane. It divides the body or a structure vertically into right and left portions. Oblique plane. It passes through the body or a structure at an angle. Now we will start by locating the anatomical landmarks and the anterior superior portion of the body. This portion here is the head, or otherwise called the cephalon. Under the cephalon, this is the frontal or the forehead. The orbitals are for the eyes. The nasal area is for the nose. And the buccal refers to the cheek area. Oral area refers to the mouth. The term mental is meant for the chin. Cervical is the neck. Thoracic is for the chest. Sternal is meant for the breastbone area. Axillary is the armpit. Acromial is the point of the shoulder. Deltoid is the curve of the shoulder formed by large deltoid muscle. Brachial is for the arm. Antebrachial is for the forearm. Antecubital is the anterior surface of the elbow. Carpal is the wrist. Digital is a term for the fingers. Umbilical is the navel. Abdominal is the anterior body, trunk inferior to the ribs. Coxal is the hip. Inguinal is where the thigh meets body trunk, or the groin. We now come to determining the body landmarks for the anterior inferior portions of the body. Femoral is the thigh. Patellar is the anterior surface of the knee. Crural refers to the leg. Fibular refers to the lateral part of the leg. Tarsal is the ankle. And digital is for the toes. Now we shall determine the body landmarks of the posterior portion of the body, starting from the superior portion. The occipital is the back of the head, and the cervical is the neck. This is the back, which is termed dorsal, and the shoulder blade is the scapular. The vertebral is the area of the spinal column, and the lumbar is the area of the back between ribs and the hip. The gluteal refers to the buttocks. Popliteal is the posterior knee area. The sural is the posterior surface of the leg, otherwise called as the calf.